Hello everyone, welcome to our channel. Today we're going to learn a very important question for pediatric examination, that is severe acute malnutrition. So let's start without wasting any time. So SAM, there are three diagnostic criteria to diagnose the SAM patient. First is the weight for height, second is the mid upper arm circumference, and third is the bilateral bleeding edema. As you know, we have a chart, WHO chart. So we plot the weight for height of the patient, and if it is less than -3 standard deviation. Second, if the mid upper arm circumference we measure using the Sharkey's tape, if it is less than 11.5 centimeter, or if there is bilateral bleeding edema, if any one of these is positive, then we diagnose the patient with the same. Now, the severe acute malnutrition we have classified into two. One is the uncomplicated case, and the one is the complicated case. Uncomplicated case, the patient, the kid's going to have a good appetite. There won't be any generalized edema. There won't be any medical complications like sepsis or shock. And if it is complicated case, the appetite will be poor, there will be generalized edema, and there will be complications like dehydration, sepsis, or shock. Why we are classifying? Because the management of the both uncomplicated and the complicated is different. If it is uncomplicated case, we're going to manage as a OPD base. It will be supervised home management. And if it is complicated case, we have to admit this patient. So first, we will talk about the management of the uncomplicated case. So, uncomplicated case we're going to manage as the OPD base. So, first, it should be supervised home management. Family should be counseled and fully engaged. Community health workers are involved. Adequate of food supply and the therapeutic food should be there, and periodic monitoring should be there. The nutrition therapy, the ready to use therapeutic food RUTF is given to the patient, and the calorie requirement, the calorie in this, it is 175 kilocalorie per kg and 4 to 6 gram protein per kg. And how often do we feed? We feed for 6 to 8 times. And how we feed, this question is also asked. You 6 to 8 times you feed, and you feed with lovingly, actively, and ensure the hygiene. These is the things we have to explain to our patient. The parents, you have to explain that your child is suffering from malnutrition. You need to give the proper therapeutic food in this manner, and it should be lovingly, actively. So first patient come to you in your OPD, you have diagnosed with the SAM, you have classified with the SAM, and you have given the RUTF to the patient, and you need to explain this to the patient को समझाना होगा कि कैसे आप इसको टेक केयर करोगे. What else do we do after therapeutic के अलावा आप और क्या करोगे? So what else you going to do? First, we will give the antibiotic, because there will be decrease in the immunity. We give oral amoxicillin for 5 days. Vitamin A, depending on the age. If it is less than 6 months old baby, we give 50,000 international unit. Six months to 1 year, we give 1 lakh international unit. And if it is more than 12 year, 1 year old, more than 1 year old child, we give 2 lakh international unit. We give albendazole for deworming. If it is less than 2 years old baby, we give 200. 2 year old child, we give 200 mg. If it is more than 2 years old, we give 400 mg. Then there will be sensory stimulation, and the monitoring should be there. So with this, we conclude our the uncomplicated SAM management. Now we will talk about the most important topic. It is about the hospital and hospital management. So the complicated case of the SAM need to be hospitalized, and hospitalized management is divided into two phases. First is stabilization phase, and the one is the rehabilitation phase. In stabilization phase, it's for last for one week. In this 1 week, we're going to restore the homeostasis. The normal function need to be restored, and in the rehabilitation phase, we will rebuild the wasted tissue which was lost because of the malnutrition. So in the maintaining the homeostasis, we're going to deal with all the complication that occurs in the same, starting with the hypoglycemia, hypothermia, infection, electrolyte imbalance, dehydration, and the micronutrient deficiency. You can remember with the mnemonic shielded. So S for sugar, H for hypothermia, I for infection, EL for the electrolyte imbalance, dehydration, and the micronutrients deficiency. So all these five things we need to manage, these six things we need to manage like very carefully. So let's start with the sugar. So this sugar, first we need to like hypoglycemia. If the blood glucose level is less than 54 mg per dl, that we will consider as the hypoglycemia. Please note, the hypoglycemia in the same patient is different than the hypoglycemia in our neonates. In neonates is 45 mg per dl, and in case of the SAM it will be 54 mg per dl. If it is less than 54 mg per dl, we will consider as the hypoglycemia. If there is any symptoms like seizure, we going to give the IV 10% dextrose. If it is asymptomatic patient, we're going to give oral glucose 50 ml. Hypoglycemia understood. First, we will check the glucose if it is less than 54 mg per dl, and if there is any symptoms, we will give IV. If there is no symptoms, we will give oral glucose. After hypoglycemia, we will talk about the hypothermia. Hypothermia, first we have to define if the auxiliary temperature is less than 35 degrees Celsius or the rectal temperature is less than 35.5 degrees Celsius, we will consider as the hypothermia. How are we going to manage the hypothermia? Are we going to warm the child using the protective clothing? Another one is the kangaroo mother care in case of the infant. So hypoglycemia and hypothermia is understood. Now moving further. Now we'll talk about the infection. In case of the SAM, the immunity is usually like decrease because of the malnutrition, and the usual sign of the infection may not be present. So empirical treatment is started in all case of SAM. Most common antibiotics we give is the ampicillin and amikacin, like penicillin in the aminoglycoside group. If there is no response, then we will give the third generation cephalosporins. This was the control of our infection. Fourth will be electrolyte imbalance. What happened in case of the SAM? There is the edema, and this edema will dilute the sodium level. So serum sodium level may be low or normal, but usually it is in excess. So we will try to not to give any supplement which increase the sodium level, and there will be hypokalemia and hypomagnesemia. So supplements for the hypokalemia and hypomagnesemia is given, but remember the sodium level increase in the same patient, and we will avoid to give excess sodium. Third is a dehydration. So in dehydration, the symptoms will be like thirst, decreased urine output, dryness of the mouth. How are we going to manage the patient who is having the dehydration in case of the SAM? If there is no shock symptoms, we will give oral fluids resomol. It is different than WHO ORS. ORS and the resomol are different. I'll explain in a different video. So the value of the sodium and the glucose is different, and the overall osmolarity is different in case of the resomol and the WHO ORS. You can just read about it. So resomol is a rehydration solution for malnutrition. Remember, this is a separate solution which is exclusive for the malnutrition. So it is very important. You need to remember each and every value of the glucose, sodium, citrate, everything you need to remember about the resomol and WHO ORS. If there is shock symptoms, we're going to give IV ringalectin with the 5% dextrose. So remember, in the hypoglycemia, it was 10% dextrose. Wait, I'll show you again. It was 10% dextrose. In case of our dehydration, it is 5% dextrose with the ringalectin. Last, it will be in a micronutrient deficiency. In case of micronutrient nutrition deficiency, the multivitamins are given, and it is given the twice the RDA value. And we usually don't give this iron in this initial phase. Once the child start gaining the weight, then we will give iron, that will be 3 mg per kg, only after the child start gaining the weight. Remember, with this, the first phase of our uh, management is completed. First step was to uh, stabilize the patient. So stabilization phase is completed. We have deal with 6 things. First, we have deal with the hypoglycemia. I'll revising everything right now, so you remember. First was the hypoglycemia, less than 54 mg per dl. Then we have divided into two: symptomatic, asymptomatic. If asymptomatic, we give oral glucose. If it is symptomatic, we give IV 10% dextrose. Remember. Second was hypothermia. Hypothermia, we have to define less than 35 degrees Celsius in case of the rectal temperature. Rectal temperature less than 35.5 and auxiliary 35 degrees Celsius. We have also learned about the electrolyte imbalance. We have learned about the dehydration, infection, everything we have covered. Now comes to the second phase of management of the SAM. Second phase of management of SAM is our now it will last for 2 to 6 weeks of the illness. So for the first week, we will make sure to stabilize the patient, and the next week we will try to rehabilitate the patient and recover the muscle and the tissue which is lost in this malnutrition. Starting, it will be the beginning of the feed. For the 1 week, we will give the cautious feeding. So F75 diet is given. So what is the caloric value in case of the F75 diet? So 75 kilocalorie uh, and zero point 0.9 gram protein per 100 gram of F75 diet. Remember, F75 diet is asked in your viva. What is F75 diet? F75 diet is given in the first week of the rehabilitation phase, or the second week of the illness. First week is our stabilization, starting of second week will be rehabilitation. So first week of the rehabilitation or the second week of the illness, we give the cautious feeding, that is our F75 diet, and our goal is to reach 80 kilocalorie per kg per day. Second phase is from the second week, we give is energy dense food. So energy dense food, it is to catch up the growth. It is given like F7 F100. F100, the 100 notes the caloric value, the kilocalories. 100 kilocalories and 2.9 gram protein is there in the F100 diet, and the goal is to reach 175 kilocalorie per kg per day and 4 to 6 gram protein per kg per day. And sensory stimulation is given, and in the last step will be prepare for the follow-up. And how are we going to know that the treatment is completed? The treatment completion, if there is no edema for at least 2 weeks, the weight for height is less than -2 standard deviation, or the mid upper arm circumference is more than 12.5 centimeter. And last, this will be the treatment completion. Before discharging the patient, we going to give the deworming. Prior to discharge, albendazole is given 400 mg, that will be single dose. I hope you understand this much. Same diagnostic criteria, you have to write 3 diagnostic criteria. What were they? First was the weight for height, -3 standard deviation. Second was our mid upper arm circumference using Charcot tape, less than 11.5 centimeter. And third was bilateral peding edema. Then we have classified into complicated and the uncomplicated case. Management of the uncomplicated case and the complicated case were different. Uncomplicated, we're going to deal with the OPD base. It will be supervised home management. If it is complicated, we're going to have the hospitalized management. Hospitalized management divided in a two part. First is the stabilization phase. Second is our rehabilitation phase. In the first phase, we're going to manage all the complications. Remember with the shielded S for sugar for hypoglycemia, hypothermia, electrolyte imbalance, infection, then also micronutrient deficiency. Everything you need to remember, how we're going to define it, how we're going to manage these all complications. And last phase was the rehabilitation phase. It is also divided in a 4 part. One is the beginning of the feed, energy dense food, sensory stimulation, and they prepare for the follow-up. And when you are discharging, you're going to give the albendazole. I hope you remember this was very short and sweet and very important for your examination point of view. Thank you so much for watching. If you have any doubts, if you have any suggestion for me to improve this content, please let me know. And till then, keep learning. Wish you good luck.